Dr. Steve Bjorn here and give you a little demonstration of one of the many different taping techniques that we use. This technique is fantastic for ankle sprains, lateral foot pain, lots of different issues around the ankle. If anybody's having any pain, kind of lateral ankle down into the outside of that foot, definitely highly indicated. What we're doing is we're going to actually push this little bone here, is your lateral malleolus, a little bit posteriorly, glide it back some. That changes the mechanics of everything that's going around here. It's called mobilization with movement technique. And the kinesiology tape that we're going to use here in this case is just a cover layer to protect the skin. The kinesiology tape isn't really doing the trick. The kinesiology tape is a little too elastic. It doesn't actually reposition the bone like we need to. So we're going to cover up the lateral malleolus, get that positioned to where we have that whole area covered. So there's that bone that we got it covered, and we're going to come around a little bit of a spiral so we end up a little higher than where we started. So it's a lot of direction we call posterior and a little bit of direction we call anterior. So it's a little bit that way, not straight back, not up, but kind of that way. And then once we got that layer on there to protect the skin, we're going to take a layer of rigid tape. This tape is leukotape, but you can use a lot of different types of rigid tape. We're going to anchor it in front of that bone. And then once we have that anchored in front of the bone, we're going to actually do a posterior glide. We're going to push that bone backwards. And when you have a bad recent ankle sprain, that initial push will hurt a little bit, but this taping technique will do wonders for it. It'll make it 100 times better, but it's worth that little bit of pain to push that back for a second, and then we push that down and bring that tape around tight so it anchors that and keeps that direction going. And we always use 2 layers of that to help stabilize it a little bit. So it looks really, really simple. It is pretty simple once you've done it a few times, but it's dramatic improvement with a lot of ankle issues. So with a posterior glide there, pull that tape around tight and then lay it down. And we'll have people retest the thing that bothered them, like trying to pull their foot to the inside or trying to go up on their toes when they're standing or just walking. Will make it tremendously better, and they'll feel much more stable and much less pain. So one example of many of the different types of taping techniques that we do here at Core Rehab. I'd be happy to help you out if you have any questions on it. Thanks.